Once again, welcome to As We Are, How the Pandemic Has Impacted Our Mental Health. We're so happy that you are here and that you will get a chance to listen to and learn from our panelists. Church Health is thrilled to be able to offer this webinar today and give everyone listening a chance to learn from our panelists about a topic that is near and dear to our mission and our work. This webinar is part of a larger series of webinars whose purpose has been to deliver COVID-19 education and resources through the lens of the local church. If you would like to watch any of our past webinars or download any of the resources that Church Health has put together, they can all be found at our website, churchhealth.org/FCE. There is no need to write that address down because afterwards you will be receiving an email with the email address that you used to sign up, with links to all this information, the link to the recording of this webinar, and the summary of it. So we are going to get going. Without further ado, I'm going to go ahead and ask our founder and CEO, Dr. Morris, to give us a welcome and open us in prayer. After that, I'm going to introduce our two panelists, and we'll get started learning about how the pandemic has impacted our mental health. So thank you, Dr. Morris.
Thank you, Lauren. So y'all, I think all of us have had the experience of the pandemic just playing havoc with our own mental health. And we have probably thought we were the only one. Only the reality is it truly is a ubiquitous, universal experience. I can tell you in my role as a family practice physician here at Church Health, it's been remarkable to me seeing people who come with an initial complaint of, I'm depressed, I'm lost. And the thing that has surprised me is I've had young men in their 20s who would never come to the doctor. They don't come anyway, but they come and the first words out of their mouth is, I'm depressed. You know, is there somebody I could talk to? That has not happened to me in the last 34 years. Or yesterday, I see an 88-year-old woman who's, I've been her doctor for many years. I haven't seen her for a year because of the pandemic. She's brought by her daughter, who's afraid that she has developed dementia. Only in seeing her, there's nothing wrong with her thinking. It's the impact of what's happened, of her being in isolation for over a year. That leads all of us to having problems that might look like dementia. So this issue is front and center, I think, for all of us, and especially for the church and people of faith. Issues around community, issues around our ability to lock arms and help each other through this with God's help. I mean, I don't think at this point there's very many things more important that churches and faith communities can do than to try to figure out what is our role in this. And so I am truly grateful for Dr. Stewart and Dr. Wilson, but both whom Church Health has great respect for in terms of your wisdom, and I'm eager to hear your thoughts. But let me begin with a prayer for us, and then Lauren will introduce both of y'all. So if we could pray together. God, who knows our hearts when they are strong and when they are broken, help us as a community of faith be willing and able to care for those of us who have struggled through the grief caused by this pandemic. Help us to see where the tears of isolation and separation have caused scars and despair, and let us use our strength of communion to bear witness to your loving and healing balm. We pray in the name of the God who sits high but looks low. Amen.
Amen. Thank you, Dr. Morris. And for all of our participants who are logging on right now, one thing I'd forgotten to mention was the chat function and the Q&A function. Feel free to use that during our webinar, and if we have time at the end, we'll have a Q&A. So once again, thank you both for coming. I'm going to go ahead and introduce who we have today. So we have Dr. Altha Stewart. She's Associate Professor and Chief of Social and Community Psychiatry at the University of Tennessee Health Sciences. And Dr. Sarita Wilson is a chaplain, certified grief counselor, director of spiritual care at Bonheur Children's Hospital, and associate minister at St. Andrew AME Church here in Memphis. So for both of you, like I said, I hope that this is going to be a conversation. Jump in where you want to. First of all, though, I will go ahead and start us off to talk about laying some groundwork in terms of what the landscape of mental health problems can look like nowadays in your experience. So Dr. Stewart, what does the data tell us about the number of people reporting symptoms of anxiety, depression, or trouble coping with stress during the pandemic? Or are there any patterns that you're seeing in particular age groups or occupations that might be noteworthy compared to pre-pandemic times?
Well, thank you first, Lauren, for the invitation of the Church Health Center to come today and be part of this wonderful dialogue. And thank you, Dr. Morris, for that totally inspiring and mental health related prayer to set the stage for today's dialogue. And also, I'd like just a moment to explain the background behind me. May is Mental Health Month, and the first week of May traditionally is dedicated to children's mental health awareness. And so here in Memphis, we are celebrating this week. Green is the color of children's mental health, and the Zoom background that I'm sitting in front of exemplifies the message we want to get out this week, and particularly in light of today's topic around the impact of COVID on mental health. Our children also, we have to pay attention to, and I'll be adding a few things from time to time as I answer your questions specific to children's mental health. So I hope the audience will bear with me, and also look for us on the UT website to see all of the activities that we have between now and Saturday for this community around children's mental health. But to your question specifically, what does the data show? You know, we didn't have to do a sophisticated research study to understand, as Dr. Morris said in his opening comments, that the nature of this impact, the sudden arrival of it, the intensity of it once it appeared, and the uncertainty about when it would be gone, have resulted in a multitude of mental health related issues. And I want to early on make a distinction between mental health and that being a state of psychological well-being that we all strive for and hope to achieve, and that we can get to doing some of the things that I'm sure we're going to talk about today. And for many people pre-pandemic, they were mentally healthy, and that was a wonderful experience and place to be. And I make the distinction early on because I don't want people to hear anything that either Dr. Wilson or I say as evidence that if you're feeling this way, you are mentally ill, because the stigma that goes with mental illness is what keeps people from coming into their doctor's office saying, I'm depressed, I'm not okay, and all of the things that were mentioned by Dr. Morris as what we are hearing more of. But we don't want people to get confused and feel that they're being labeled as being mentally ill, when in fact what most of us are experiencing are normal responses to abnormal experiences. We've never been through a pandemic, but the data tells us that throughout the past year, more people have self-identified as having challenges emotionally, psychologically, what they would call mentally, in the areas of anxiety, depressed mood, and you notice I said depressed mood, not depression, concerns about individuals in their lives, whether it's a family or a friend or their work, where the suddenness of the change has totally turned their world upside down, and they're having trouble recalibrating, stabilizing, and they're worried that they don't have whatever resource internally is needed to get back to where they believe they need to be. What we've been calling our old normal is where people are striving to get back to. Before the pandemic, I was able to deal with this. Why can't I deal with it now? And what I think we all have to do, and in the spirit of today's topic and host, I think we all have to give ourselves just a little grace as we go through these challenging times. None of what we do going forward is going to feel the same as it did pre-COVID. You know, I'd like to say that's a stretch, but I really have come to believe over the last year that what I consider my old normal is not where I'm going to get back to. And I think that's true for most people. And if you're feeling anxious, feel that your mood is now more depressed, if your sense of loneliness and isolation is beginning to be overwhelming, almost oppressive, you are not alone. The challenge we now face is encouraging people to be okay, that they don't feel okay, and okay, more importantly, with asking for help as those feelings arise.
Definitely. And have you seen anything since pandemic change in that regard? I know you've been talking, you just gave us the background of, why you're here and what we've been seeing, and Dr. Wilson, you might be able to add on to this too with your experience working in Bonheur, but I'm wondering, are there any ways or trends or groups of people that you feel like have been more affected by this pandemic, or I think that's what I'm trying to say.
Well, we certainly are seeing challenges of significant proportions in the psychological distress area as it relates to communities of color. Women tend to have more challenges in this area than men. And we think in part that's because we tend to take on more responsibilities. So the more these kinds of issues we're confronted with, the more challenged we are to not only do what we've always done, but to now take these things on. And then there are the what I would call the special populations. Children, of course, fit into that category. Young adults who are in transition between childhood and adolescence and adulthood are also in this category. The elderly, that patient that Dr. Morris mentioned, that the family's worried about, they are particularly sensitive to these kinds of stressors, whether it's the impact of the pandemic itself in terms of the virus and all that comes with that, whether it's the nonstop news cycle of social and racial injustice and the impact that has, or whether it's just that sense of loss and isolation that has come with the pandemic, because we've lost our rituals, we've lost that connection, that communing that he talked about, that ability to join hands together and get through things has been ripped away from us. We can't celebrate birthdays, weddings, births, deaths, transitions in life that are ritualized depending on your community and culture. There are certain things that we have come to understand as normal for us and that we rely on to maintain that balance of normalcy. Those things have been ripped away from us over the past year, and we're just now getting to the point where we're able to even get out and touch anymore. So I think there are those kinds of communities. The other population that I'm very concerned about is people who are incarcerated or people who are being released from incarceration, because often we forget about them while they're locked up. And then when they return, we expect that they're just going to magically reintegrate into society. And they always had challenges of reentry. But in the pandemic and post-pandemic era, there's going to be increased challenge for those individuals, everything from accessing healthcare to stable housing, to employment, and just rebuilding relationships for themselves, whether it's with their family or in a community or in a church group. We have got to be very willing to extend ourselves for all of these populations. And I just think the church is the ideal place for that kind of work to begin and to become part of the new way of communication and communing.
I would agree. Thank you, Church Health Center, and for having me. And Dr. Stewart is exactly right. I think although we've seen some groups, specialized groups, really impacted more, I think there's not a group that hasn't been impacted. When you look at how children have had to do school and how they are having to do the distance learning and how that's impacted them and how they're not able to relate to their friends or be around community, how mothers and families or parents and children are relating in the house. We've seen such a rise in domestic violence because of the pandemic and people just being in each other's space all the time. And so I think that it's impacted every group, But I think that, as Dr. Stewart said, there are some groups that have definitely been impacted. We cannot negate the impact that this has had on children. I think in our generations and in previous generations, we've always said, oh, they'll be fine, they're just children, but they have their own mental health concerns and needs. They have their own connection needs. They have their own social needs, and those cannot be negated or minimized in this pandemic. It's very important to their socialization, to their growth, to their education, and that's missing. And so when you look at test scores now and grades and all those things, you look at, I was on social media over the weekend, and all the children that have had to announce their colleges and where they're going and having to share all of that through social media. I have a child that's in college, and having the distance learning while you're supposed to be on a college campus and missing the whole college experience. And so you see that group, that age group of young adults that are really impacted, dealing with, as Dr. Stewart said, depressive moods and anxiety and all those things have really, really increased. And when you talk about church, and church being that place, youth groups not being able to connect, so much about youth ministry and children's ministry, and how children and youth grow up in that space and get their social and spiritual needs met is missing if churches are not meeting those needs. And so it's a great concern for how they're finding connection and meaning in life. And so that's where you see a lot of missing links during this pandemic.
Yeah, thank you both for explaining that. So when we're thinking about the people who are tuning in today and kind of what we want them to be, to take away, a lot of them are local pastors or lay leaders in congregations in Memphis, but also across the US, but mostly here in Memphis. Can you guys just give us a primer on what barriers and inequities there are in access to mental health services, such as for low-income individuals, people of color, all of these marginalized groups that we've kind of touched on? Like, what are people facing nowadays, even more specific to the pandemic, in regards to barriers than before? Because it is one thing to have a mental health webinar and talk about all these issues, but before we can get to the solutions, I do want people to have a good baseline understanding of why these things are difficult in the first place. And that's to both of you, please.
I think a big part is just eradicating the stigma, first of all, about mental health. I think one of the things I want to say is that although we may not all have mental health disease, we do all have mental health concerns. We all have moments of anxiety. We all have depressive moods or things that impact us: isolation, distress, spiritual distress, emotional distress, mental distress. And so sometimes I think one of the main things is eradicating the stigma, especially in the African American community. As a clergy person, I know for myself and the constituents that come to me, that most people say, oh, we're just going to pray about it, or we're just going to go to church about it. And while that is good, and while that is helpful, and I will always be a proponent of that, it's counseling and church. It is prayer and counseling. It is all of those things combined to keep us holistic and healthy. And so some of the barriers, I think, mainly are the stigma. Knowing that it's okay to not be okay, and to talk about it and to share about it and to feel safe about it. Oftentimes people will share something even with a pastor and then hear their situation come up in a sermon on Sunday. That's not safe. And so finding safe places to be able to share your story, to share your narrative, to share your concerns, I think has been a barrier. And just your community of people around you who don't support you in getting support and getting the help you need. And so being around people or connecting with people who say, you know what, it's really okay to get support. It's really okay to seek counseling. It's really the healthiest thing you can do for yourself. Being a proponent of your own healthiness and your own holistic care and your own self-care. And we haven't always been taught to do that. As an African-American woman growing up with, that whole African-American strong woman syndrome, and, being superwoman all the time, you power through, you power through, you power through. But we've got to stop. Sometimes we get in our own way and we block our own blessings, and we are the barrier to our own healthiness, because we don't stop to take care of ourselves, because we have been raised with in this attitude, in this atmosphere, that we just got to keep going. But you've got to learn to take care of yourself. And then, and I know Dr. Stewart can speak more about this, but access to care in neighborhoods where there's just not enough services, not enough resources. So you're dealing with poverty, you're dealing with access to healthcare, or lack of access to healthcare, lack of counselors, or in your community. And that's a big barrier for people. Transportation to get to these places, all of those sorts of things go into people not getting the support and seeking the services that they need.
Amen, amen, and amen. And the things I will add, because you did a wonderful job of capturing some of that spirit of what goes on in the minds of people who could benefit from service and what keeps them from accessing services if they are available. And I wanna go a little further and drill down into what's available, particularly in the Memphis community. And I think one of the myths is that there aren't services available, especially for certain groups, that if I'm Black and I think I need some therapy, there are no places where I can go as a Black person and feel like I'm going to get good treatment. And while I will admit that there are hardly enough Black therapists at any level in any discipline to meet the clear needs of people of color, especially African Americans, we have within the city, we have programs and other alternatives for care where you can actually go and get what we describe as a culturally competent care, delivered by people who understand the importance of how you integrate one's understanding of behavioral health and mental health into what's going on in their lives and what's creating them to feel like they're not functioning at 100%. We actually have a pretty good track record of that kind of work going on, combined with a lot of focus over the last couple of years with making sure that every provider of mental health service in town understands that care to the population we're talking about, and especially in the midst of this pandemic, has to be done in a trauma-informed manner. And so we have mental health centers, we have private therapists from psychiatrists and psychologists and social workers and licensed clinical therapists and pastoral counselors. All of these people are adequately trained to be your point of entry. In the public mental health system, all of our community-based providers are part of what we call in the state of Tennessee, safety net providers. So if you don't have insurance, you're not eligible for Medicaid, and you've got no way to pay for the service, you can actually still get a good quality care through the mental health centers in town, and that would be Alliance Healthcare Services and Case Management, Inc. They are what we call our safety net providers. And so the state actually funds them for those situations where someone is in need of help and has no way to pay for it. And if it's not being offered at the Church Health Center or the Memphis Health Center or any of the other federal or public health clinics in the city, that there are these specialized services at our mental health centers that are run by mental health professionals that can deal with all of these. And I know, because I have worked with all of them, that if you go for help there and you ask for help in a way that meets your cultural need and you don't get it, you have the right to say to whoever runs that program, I need this and I didn't get it. How are you going to help me? You know, learning to advocate is a part of taking care of one's own mental health. This is not easy stuff to do, and I realize that. And for children and families with children who have mental health issues, there are several programs in town specifically for them where the family is a part of the treatment. It's not the child goes in to see the therapist and comes out 15 minutes later saying, I had my therapy, I'm ready to go home. We have in Memphis something that we call the system of care, which is the actual name for the project. But it's also done in a manner consistent with what we call in mental health wraparound approach. It means that from the moment you appear at our door, everything that we do, and we have a specific program at the University of Tennessee, it's called Shelby Connects Network, and it is our wraparound program. If you appear at our door and say, I need some help from my child, there's a problem in school, or there being a challenge at home, or since COVID started, they're out of control, I don't know what to do. Before COVID, they said they were ADHD or ODD or any of the Ds that people have heard and are afraid of. This is the program where we accept people to come in as a family. We talk with the entire family. Our focus is on family-centered, youth-centered work. So it's not, I'm going to send you over here for some therapy. You're going to go over here for your medication, and oh, mom, we're going to send you over here for this. Wherever we work with you, it's as a team. And so I would encourage, excuse me, anyone who is listening and has those kinds of concerns, especially about a child, that's somewhere where we guarantee we will be the point of contact. We believe in a no wrong door way of working with families. Wherever you come in our system, wherever you enter, we will make sure to get you to the right place. And we're not just going to give you a piece of paper. We're going to make sure that connection is made. It's going to be a handoff, not a take this in your hand and go. The final thing I want to say has to do with how we approach asking people to get help. I don't know about everybody else, but when I enter a healthcare facility, I'm looking for a sign that people are welcoming, that I'm just not another irritant in the course of their day. And I have myself, as a physician, I can tell you honestly, I have been met by some of the most rude, impolite, interaction at that first point of entry. And if you're going in for something as sensitive as your mental health and concerns about whether there's something wrong, that first word out of someone's mouth that says, what are you doing here? Or what you want? Or who told you to come here? This is the wrong place. You know, all of those things matter. And so we talk a lot about trauma, and we practice in Memphis. We're spreading the word that we want to practice in a trauma-informed manner. And that means everybody from the person who greets you, to the person who provides the service, to the person who escorts you out so that you can check out and get your next appointment, is grounded in that. The cleaning staff, the people who take your information and give you that clipboard with those papers you got to fill out before you see anybody. All of those people have to be trained to understand that's how we encourage people to come for healthcare.
Yeah, I agree. I think the thing that most people are looking for when they have to come for treatment is something as sensitive as mental health is compassion.
Mm-hmm.
It's human dignity.
Mm-hmm.
It's understanding, it's empathy, it's all of those things. And so when you walk into that door to seek mental health support, as you would with any other treatment center with physical health and a church,
Mm-hmm.
you're looking for compassion, you're looking for understanding, and you want to be able to connect with those providers. And if there's no compassion being given on the front end, it makes the connection for treatment more difficult. And so as providers, as clergy people, as anybody that is supporting anyone with mental health issues or concerns, compassion, someone who listens and listens to understand and not just listening to fill out a form. Fill out a form, absolutely, but compassion and empathy.
That's exactly it. And thinking about how individuals can develop healthy coping strategies and lean into our spirituality to help, heal and move forward. Dr. Wilson, I wanted to start with you on this one, but how do you think spiritual health interweaves with mental health, and how can we give individuals tools to support mental health at this point in the pandemic integrating that spirituality that you brought up several times?
Absolutely. One thing I want to make sure people understand is when we say the word spirituality, we're not talking about your religious practices. We're not talking about where you go to church on Sunday. We're talking about how you make meaning in life, what's important to you, where your values lie, what gets your feet on the floor every morning, what gets you out of bed. That's what spirituality is, what grounds you, what keeps you. And so when we talk about different spiritual needs, we're talking about the things and the places where you make meaning. And so there is no disconnect. We are all spirit, we are all soul, and we are all body. There is no disconnect in any of those parts of our being. What impacts us spiritually impacts us emotionally, impacts us mentally, impacts us physically, and it's a cycle that never stops. So when you don't address one part of your being, you neglect the other parts as well, because ultimately they'll all catch up with each other. So when we talk about spiritual care and coping mechanisms, we talk about, feeling distress. We talk about being in a drought. We talk about having depressive moods. We talk about anxiety. We talk about loneliness and fear and isolation. Those are all spiritual issues. They may at some point manifest themselves emotionally, but they are all spiritual issues. And so looking for places where you find hope, where you can find resilience, where you can build when you build that resilience muscle back up, where you find a glimmer of light, that whole adage of light at the end of the tunnel. We're saying here in the hospital now, we see light, but we're still in the tunnel. but being able to find a little light at the end of the tunnel. And so finding those places and those connections and those things where you make meaning and you make life and you make connection is what becomes really, really important. So in this world of isolation, you know, we've got great resources in Zoom. We've got great resources in all these smartphones we all have. And I know that we're all zoomed out. We're all tired of looking at each other on the screen. But whatever resources we have to use them because connection is so important, especially in those isolated groups, as we talked about earlier, the elderly, reaching out to make a phone call and following up with people. If you say you're going to call. You know, I think this is the time, I think we've all lived in an era where we say, oh, I'll check on you and I'll do, you know, I'll call you and we'll talk soon. But this is the time where we really have to do that because we're living in an age now where it's not here today, gone tomorrow. It's here today, gone today if we're not careful with our relationships and with our lives. And so taking the time to, when you think of somebody, call. When you say, I'm going to be praying for you, really pray. Sometimes you have to pray right there on the spot. And so it's all of those types of things and using the resources that we do have available to our advantage so that we can keep connection. Spirituality is connection and connection is spirituality. And that's really what it's all about in this pandemic era in which we're living. It's about making connection and keeping connection and making sure that those connections are healthy. All connection is not healthy connection. And knowing those are relationships that are healthy for you and being able to sustain those relationships and maintain those relationships in a manner that is mutually connected, in a way that is mutually healthy, and finding areas in which you can do that. And if it's Zoom, if you are vaccinated and feel safe, it's, you know, small group meetings, but still being very careful because we are not out of the woods, but finding those places where you can maintain and sustain some connection.
And if I could, Lauren, I would add, you know, for a long time, the sense was that pastors and psychiatrists were not on the same page about things. And in my experience, and I'm a native Memphian, and in my experience, both the field of psychiatry and the faith community in general have begun meeting much closer at a place where they understand the overlap in their work, the overlap in the people that they help, and the importance of them working more closely together. And I have to tell you, I have given talks to clergy around the country, and the one thing that I am convinced now of is that we've made a lot of progress in things like Dr. Wilson and I being on the same program, repeating each other's words essentially, because we know how important the work that we each do is, but we also know about that overlap because the people who come to her for guidance and support and counseling may ultimately be the same people who come to me. And if I don't give my value statement around how important her work is, they feel like they've got to choose between the pastor and the psychiatrist, and they should not have to make that choice. And so things like this session goes a long way to helping anybody who's a psychiatrist in the audience or anybody who's a clergy in the audience to understanding we have a lot more that we could accomplish together. In this particular work, we really do have to work shoulder to shoulder. And I just wanted to add that to your excellent response, Dr. Wilson.
And I thank you. And you are so right. We are all on the same page. We are all on the same team. And we just want everybody to be holistically healthy, spirit, soul, body, mind, every part of your being, every dimension of your life needs to be healthy. And that's what we're all striving for. So we are definitely on the same team, same page.
And I say, I really wanted to use that, what you said, Dr. Stewart, as an excuse to pop in one of our questions that we got in the chat earlier, because it really goes closely with what you're talking about. I have some more questions, but I really want to touch this while we're here. The comment was, what would you recommend for people whose church experience does not lend itself to introspection or questioning? It can be difficult for them to even recognize that their mental health is at risk or suffering. So that kind of brings in that larger question of what do you do when somebody's faith might be, or theology or worldview, or however you want to put it, might be in direct opposition to seeking mental health care? Do y'all have any thoughts on that? Just a small question for you.
I encounter that a lot. I know a lot of people, and especially when you deal with deal generationally with people who were raised to believe that mental health is just something you pray about, or that, psychotherapy is not for people of faith. You just pray about it. I say one thing is that you got to know for yourself, one, and you have to know what you need. And although we all respect our church and our faith and our clergy people, you still have to be able to understand what your own theology and your needs are. You have to and I would not advocate for anyone to leave their faith center, but you also have to seek additional resources that support what you need in this season. And so, sometimes it's a different, I know people that go to church at one place, but go to another Bible study to get that additional feeding. I know, people that, may have, in this world of online and where so many resources are online, you can tap into other church communities, other faith communities, other resources to kind of get fed what you need. And it's never to debunk or debate what somebody has taught you, but understanding for yourself. And I think that's one of the things generationally, I know I was raised, what mama said was true and what mama says is right. And nobody wants to go against what my mama said and what my grandmama taught me. But we're in an age where we have to start to dismantle some of those myths and to unlayer some of those myths and really come to understand things for ourselves and know that your faith and your your mental health, they are hand in hand. So to understand that. And so it's an education process and teaching people, teaching churches and having functions in formats like this, even in churches and even in Bible studies and all of those things where we can talk and educate people on what the reality of our situations are and the reality of our health is, and helping people to see the whole scope of things and not just this one dimension of their being. And it broadens things so people understand mental and emotional health, spiritual health as all connected and as this circle of things, this cycle of things, and not just this isolated part of who they are. But finding those places and tapping into those places. And it's not easy, because if you're raised a certain way and you have a certain mentality or theology, it's really hard to unravel some of that. But being willing to be willing is the key to search and do a little soul searching and dig a little deeper to what you need. You're muted, Dr. Stewart.
Far be it from me to disagree with Dr. Wilson. So I'm going to talk from the standpoint of my role in this type of an encounter. I always find myself asking people, how is anything that could be affecting your mind and brain different from anything that might affect your heart or liver or stomach or any other organ in the body? And help people understand that mental illness, if that's what it is just that, an illness. And just like we have diseases in other parts of our body, we seek medical treatment. I don't know of anyone who would be standing in front of me arguing about whether or not they should go to the emergency room when the chest pain becomes unbearable because they need to just pray it away. I really believe that this distinction that we make between the mind and brain and the rest of the body is often what gets us into these kinds of debates, if you will. And so my position is always, I think we have something to offer that helps if you are feeling that this is going on, if you are thinking in these ways, if you believe that you need help. I think we have something to offer. And since I know several ministers in town who have actually delivered sermons chronicling depression in people in the Bible in ways that meet the criteria for the DSM that we use today to diagnose, I'm fairly comfortable that I'm on good, solid religious ground when I say these things to people. And I try to stay in my lane as a doctor and not stray over into the pastoring. But I really do believe that, as you said, Dr. Wilson, it's about educating people. It's about creating a space for them to safely consider something other than what they have always believed, and to not feel, again, that they have to choose, that both can occur simultaneously without violating that great bond that we all have with our faith. So that would be my response to the question.
I love that. And when we're thinking about this interplay between, religion and church life and then mental health and treatment, many people have navigated various losses and grief during the pandemic, right? Right up to losing a loved one and not being able to hold or attend in-person funerals. how do you guys see the rites and rituals of faith interplaying with mental health when the church has to be creative about how to come alongside people, even in extreme losses, right? Like, how do those two things connect nowadays? Or are there ways that you've thought, wakes you up in the middle of the night, of creative ways to do those rites and rituals and come alongside people?
I think Dr. Stewart hit on it earlier when she said we are not going to go back to what we used to do and what we considered normal. We're creating new normals every day. And to be able to be open to embracing what those new normals are, be it in rituals and be it rites, be it, communion, be it weddings. So many people have had to alter wedding plans, baptisms, all of those things. And so understanding that, there's a difference between ritual and there's a difference between tradition. Traditionally, we've always done things a certain way. But at some point in time, in order for us to still do things and hold on to something, embrace part of it, you hold on to the parts you can, and we have to learn how to release the parts that we can't and create new ways of doing things so that we can still find meaning in them. Because oftentimes it's not about the ceremony or the ritual itself, it's about what it means to us. And if it still means something to you, if it's still something you can hold close to your heart, then you treasure that. And so finding ways to, as we talked about earlier, being creative in even rituals, even though the discipline says we've always done it this way, and this is the way the church has to do it, we've had to alter those things, even on Communion Sunday, all of those things that have become important to the church. And so being able to feel open enough and okay enough to feel like you're not losing anything, you're gaining as you create new and different ways to do things, but understanding that we may not ever experience life as we did prior to a year and a half ago, but being able to understand this is the new normal, because that's what grief is. Grief creates a new normal. And, it kind of creates this new interwoven fabric of our being. It's not, we don't ever stop grieving. It just becomes part of the fabric of who we are now. So being able to intake that and who we are and incorporate that into who we are now. And people are grieving not just death, but there's so many other losses that people have had during this pandemic, be it loss of job, be it loss of income, be it loss of connection, be it loss of support, so many things. And so to understand that grief is, although we are universally experiencing this communal loss, grief is still very individual and grief is still very unique. No one person grieves the same, no matter, even though we're all kind of going through a very similar situation. So being able to find those spaces that are meaningful to you and to embrace those. And I know I keep saying that because that's really what it is. And that's really what grief work is being able to embrace where you are and try to move forward in a way that doesn't make you negate or lose what you lost, but hold on to those parts that are still meaningful to you, that create memories and that create warmth and that create value to you. And holding those places close to your chest and finding safe places for those things to happen.
I'm getting stuck on, I feel like a lot of the times in most everything that we read about or hear about the pandemic, we talk about trauma a lot, right? This idea of personal trauma that we've experienced, mass trauma, but I haven't heard as much about grief. And I do feel like grief is one of the places where congregations are kind of particularly apt to be able to walk alongside people. In the past, people have taken, in the pre times, they have taken their grief to congregations and to their pastors and to their people there quite easily. So thank you for touching on that. I think that that's something that oftentimes we forget that we have to allow ourselves to think about as well, as the grief of this.
Yeah, we have to, as Dr. Stewart said earlier, extend some grace to ourselves and know that this is a process and that grief is just not something that has an endpoint. Grief is, lasts as long as and uniquely as the people that are experiencing it. And it's not easy, right? It's not easy to not be able to go to a service because that's where we find closure at a funeral oftentimes. It's not easy to not be able to say those last goodbyes. It's not easy to not be in the room holding a person's hand when they take their last breath. Those are things that traditionally we've all been able to do and wanted to do. So what do we do when we can't even find closure in the midst or even be there? Or we have to hear about it on social media or we hear about it secondhand and we can't be there. That's hard. So extending ourselves grief and to know that this is some things we can't control because we still have to be healthy ourselves. We still have to follow the protocols as set out by our institutions or the government or whomever, so that health care institutions, so that we are healthy. But knowing that it's okay to grieve, that we all grieve, and it's okay no matter what we're grieving. So if you think it's something, and being careful not to minimize anybody's grief, giving people space and time to have whatever time they need. And it could extend years, it could extend months. We don't know how people's grief look, but understanding that no matter what your grief looks like, as long as you are not causing harm to yourself or causing harm to somebody else, that's normal. Because grief doesn't have any type of picture frame or any time frame or anything. It's very individual and very unique. And we're all grieving on some level. Some people are grieving hope. Some people are grieving dreams. Some people are grieving the fact that they couldn't see their child walk across the stage and hear their name called because the graduation had to be virtual. There's so many things that we've lost in this pandemic. And so being patient in the midst of this process, having grace for others and being gracious to ourselves, and just finding places where there's light, and finding places that are safe, and finding places where you can experience and find whatever. You may not find closure, and being okay with that. And I think, as Dr. Stewart said earlier, being okay when you're not okay, and knowing it's okay, knowing your tears are okay, and not trying to stifle them or hold them back. All of those things are healthy grief. And we have learned, as a culture, have to learn how to grieve healthy, because we don't know how to grieve as healthy people. We want to give people tissues and stop the tears. No, let people cry. That's how they get it out. Let people have their time. Let people have their moments. This has been difficult on a lot of levels for a lot of people. Even those of us who are considered to know what we're talking about have grief, and have grieved, and have cried, and have lost. And it's not been easy for anybody. So being gracious and having grace and finding moments of gratitude and expressing that gratitude in those moments and sharing your stories in a safe place becomes very important.
That isn't that a gift? The idea that you could be told it's okay. It's okay to be sad. It's okay to grieve. When you said that, I could feel just a calming sensation. And when I'm thinking about congregational life, when you're thinking about mental health and ways that churches can walk alongside people during this time, that's one of the first things that comes to mind. And we've gotten several questions in the chat and on Facebook. So I want to go ahead and posit this to y'all about creative ways that congregations can continue to encourage mental health, encourage people to seek out help when they experience mental health problems, right? So I'm curious to hear from both the clinicians, well, you're both clinicians, from the clinical side and the spiritual side for both of you. What are some of those things besides what you've already mentioned, which was just normalizing, quote unquote? Normal is not a great word, but normalizing what people are experiencing right now.
I think it starts in the pulpit. I think you have to have pastors who are not ashamed or afraid to speak the truth about mental health and to give it a platform in the midst of a sermon or in the midst of a Bible study or in the midst of whatever platform that church already uses where they have the ears and the hearts of the people. I think that's a good place to start. I think, in finding small ministry moments, or even within the context of different ministries, if you're in a seniors ministry or you're in a young adult ministry or you're in a choir or a dance ministry, using those as places where you can kind of weave it in if you can, to know that so the language is being spoken in all aspects and on all platforms, and everybody is speaking the same language, so that people get the support in their small group settings and in the context of the congregation. I think that's part of what becomes important.
Yeah. And, again, I never interrupt a pastor. So I'm going to stay in my lane, Dr. Wilson, and talk about this from the standpoint of, if all of that is getting done, where then do people like me need to be prepared to fit in? And I think it's a couple of places that we need to be more visible as resources for your congregation. We need to make ourselves known to the clergy community that we are open and willing to provide education, information, share resources, be available. Many mental health professionals in town are also members of church. And so knowing the resources in your church, where it may not be as comfortable, but at least you've got somebody to help guide your steps as you are crafting your plan as the shepherd of this flock. And so somebody to talk through things with, somebody to point you in the direction where, you know, we seem to have a lot of women in our congregation who suffer from a same kind of something. And I wonder if there's anybody in town, could we offer a support group here and make it okay in this space for this to be dealt with? For people who have lost jobs, being aware of the fact that if you've got a mother or a grandmother or an aunt in your congregation who's been raising a child, who's had themselves some challenges, and they've successfully navigated that child through the system to where they think things are working well for their family, that might be somebody who, if she just lost her job as a nurse's assistant or something, has a mind for healthcare, that might be somebody you want to recommend, consider becoming a family support specialist. In Tennessee, a family support specialist only needs to be a caregiver of a child who has had to navigate the mental health system for that child. The state will train them for free. The only thing it means in terms of finance is a certification exam, and they even offer scholarships for people. So there's a whole workforce development piece that is going to come out of the COVID pandemic disruption economically and employment-wise that may become the basis for some people finding a new lease on life, a passion for helping people that starts in that church. Because pastors are aware of these opportunities. The same thing for peer specialists for adults and for peer specialists for people with addiction problems. So there's a host of ways, I think, but it begins with knowing what's available, us being visible and willing to interact, and making sure that we always give the message, no matter what side of this we're on, whether it's the clergy or the clinician, that we give a consistent message of whatever you are going through, it's okay to talk to us about it. It's okay to ask for help about it. And it's okay to feel some kind of way about feeling that way. That's the bottom line.
Yeah, absolutely. And the other thing I want to add is that for pastors, for clergy people, to know when it's okay to refer, to be able to have a list of resources to refer out to professional psychologists, social workers, psychiatrists, and to be okay that saying that you just don't know, or you don't have the answers, and to know when things are beyond your scope so that you don't do more harm than you do help. And so being able to refer and have a list of community resources that in your church that you can use to refer your congregation to.
Absolutely.
Definitely. And I think we've only got a couple more minutes left, so I'm going to leave us with this final question. What is one simple practice that both of you would suggest that anyone could use for positive mental well-being? What are we going to leave our people with?
I'm a big believer, I'm going to let the past have the last word. I'm a big believer in deep breathing, in centering and meditation, in allowing yourself to be still, even if it's just for a minute, to just take that moment and be still. If you really are sophisticated in this meditation, mindfulness stuff, practice that as often as you can and do it whenever you feel the need for it to help you center again. And to recognize all the things that we talk about generally for good health, whether it's nutrition, physical activity, monitoring your own health care and any medical conditions that you have with a clinician, doctor, nurse practitioner, physician assistant, whoever gives you your service, monitor with them those things that have already been identified as a problem in hopes of preventing any more from happening.
I'm going to say, thank you, Dr. Stewart, for that confirmation. Sometimes you just have to find moments of solitude. And notice I did not say isolation, but solitude. And there is a difference. Being able to be still, whether it's prayer, whether it's music, whether it's meditation, whatever is comfortable for your being, but finding that time where you can just sit and reflect, reconnect with nature or your God or whatever you need to reconnect with. And then I say that in terms of self-care, you need self-care for every dimension of your life. So you need something physically for self-care, something emotionally for self-care, something spiritually for self-care, all of those things. And then lastly, I just say that you go to your OBGYN every year, you go to your eye doctor every year, you go to your dentist every year, get a mental health checkup at least once a year. Just like you take care of every other part of your being, take care of your mental health and take care of yourself.
I thank you so much for that. That was, I think, a really wonderful ending. And thank you just so much for sharing your expertise. We've been getting, and you haven't seen a ton of it, but we've been getting a ton of comments on the Facebook Live and in here of just people saying, yes, exactly. And oftentimes I feel like these webinars, although they introduce new ideas and new concepts, sometimes it's just a place for like-minded people to gather and be fed with other people who believe the same, right? To get that confirmation that you're on the right path and that you're doing what you need to do. So before I do my last bit of announcements and everything, Dr. Wilson, would you close us in prayer?
Absolutely. Let us pray. God of love and God of light, God who created us all, spirit, soul, and body. God who knows us better than we know ourselves. God who knows everything that concerns us, everything that troubles us. Be God in our lives, be God in our space, as we sit in your presence, realizing and recognizing that your presence is with us. God, we pray that in every breath we take, we feel your presence, we feel your embrace, we feel your love, we feel your peace, and we feel your joy. Now, God, as we depart from this time together, we thank you for the connection, for the words that have been shared, for the resources, and most of all, God, that you were here abiding with us. Now, God, let your light guide us, keep us, and hold us in healthiness and in wholeness. In your name we pray. Amen.
Amen.
Amen. Thank you, everyone, for tuning in. The last things I want to say to everybody before we finish off is that just a reminder, you will be getting an email follow-up with a link to the recording. However, this was live on our Church Health Facebook page. So right now, actually, you'll be able to go in and share that and go back and look at your favorite parts and just send it along to anybody who you think needs to hear what was said today. We are not done talking about mental health in the pandemic. So if you want a part 2 to this webinar series, we are going to have it on June 8th. It's called As We Gather, How the Pandemic Reshapes Our Experience of Coming Together. And the second part is really going to focus more on congregational life. So if anybody's interested in that, the registration will be in the follow-up email, hopefully that you get sent soon. So be on the lookout for that. And also just a quick plug, Church Health is one of the teaching sites for a class called Mental Health First Aid. We do have our next virtual class coming up on June 15th. You'll be able to register for that on Eventbrite. Currently it's live. And, as we move forward, into maybe meeting in person, there will be more opportunity for that as well. But currently we are teaching that virtually. So if anybody's been kind of wanting to learn a little bit more about how to become a kind of like a first responder as a citizen for mental health problems, that's an excellent class. Okay, anything else y'all want to add or good to go?
I just want to say thank you. Thank you for inviting me. Thank you, Dr. Stewart.
Yes. Thank you.
Absolutely.
Thank you, Dr. Wilson.
Yeah.
This was great. Thank you.
It was wonderful.
And thank you to the audience.
Absolutely. Thank you for all who joined and all your comments and support. Thank you.
Yeah.
Well, y'all have such a great day and we could not be more grateful for your time. Seriously.
Pleasure.
Okay, I'm going to go ahead and end the webinar and everybody can have a wonderful Tuesday. It's Tuesday,
Thank
right?
you. Bye-bye.
Bless you. Thank you. Bye-bye.
Bye-bye.